Time now for this week's Health Matters. Paul Critz with you, PA Lynn Szabo, and we're joined in the Fug House today, Mike Henderson, community pharmacist. Are we allowed to mention your employer? Or are we keeping that just...
They don't want their name on air, but everybody knows who I work for.
That's fine. I don't like saying their name on air either. So it's a topic that Lynn discusses and we discuss often, and we always say, it's great when we start talking about rural pharmacists and pharmacies in communities like ours. And we go, it'd be great to get Mike back in here. And here you are this morning. So Lynn, where do we begin?
Well, kind of happy Pharmacist Month, Mike.
Thank you.
Yeah, that's an exciting thing. That's one of those things that you really only celebrate privately and among your colleagues. But I'm wondering why we had a local pharmacy all of a sudden close. What can you tell me about that?
So a lot of that comes back to the Del Norte conundrum. It's a beautiful place, beautiful people. But unfortunately, housing is an issue, and I don't know the motivator for the only pharmacist that worked there having to leave this area or wanting to leave this area, but she decided to relocate away. Mm-hmm. And the end result is that company doesn't have enough surplus pharmacists in the immediate surrounding area to keep the store open. And so they're going to do what they can through their close date. But then without a pharmacy, that business doesn't really operate. So
Are they actually closed now, the pharmacists? Because we were rerouting prescriptions to other pharmacies.
So they're closed for 3 days for sure.
Okay.
But their close date isn't for about a month.
Okay.
A little over a month.
All right.
But it's the same reason that when I left at the end of 2021, our company had to reduce their hours, and close on Sundays, and at one point close on Saturdays. There just weren't enough pharmacists to open. Again, if there's not a pharmacist on duty, technicians can't do anything, and those technicians have a cost.
Right.
And so with this one that's closing, when they purchased, I believe it was Pacific Drug, they also purchased their employees with a guaranteed rate of pay that was part of their purchase agreement, and it was higher than the industry standard at that time by a lot. Mm-hmm. Now it's closer to the industry standard, but they've received raises over the years and whatnot. But essentially, you've got a large body of support staff that have guaranteed hours under California labor laws that can't be utilized without a pharmacist on duty, and
so it's pointless for them to be there. Pretty much, they're not going to make any money. And I would think
they would bleed money.
I would think if I was one of those individuals, I would be looking really quickly for what other farm tech jobs are available in the community and kind of be like disappearing.
So one of the unfortunate things that I actually sent out an email about on Friday to my current market leader is that pharmacy represents 20% of this town's processing power. We have 5 retail pharmacies. Right. The DEA limits our ordering capacity for controlled substances based on our 5-year purchase history. So they average our 5 years, and you're allowed to purchase up to 5% over that. And if you place an order beyond that 5%, it's considered a suspicious order. Because you have things like what happened, I think it was in Minnesota, where there was a pharmacy that had more doses of Norco than they had people per day.
Right.
Like it was ridiculous. It was like a town of 6,000 people similar to this, and they were running through something like 40,000 doses of Norco a month. And you simply can't justify that. And so they've put these stops in place that are meant to prevent those scenarios. But in a situation like ours, where we're looking at, 4 of us have to absorb 20% of the processing power, or roughly 1,500 prescriptions a week, of which I would estimate, based on what I've heard, is about 25% of that is controlled substances.
Right. A lot of people like to go there because of the drive up. They
also like to go there because they haven't been practicing opioid stewardship, and nobody's questioned their prescriptions at all in the last 6 years.
That's kind of interesting.
So that's something that we've been doing. I actually started ahead of the corporate initiative as soon as I graduated, because what happens in Delaware County doesn't happen in many other places in the country.
Right. Better to be proactive than reactive. Yeah, I get it.
So
Yeah, and so what I hear back from them is the pharmacy could only give me half my prescription, and then there's distress and oftentimes delay, and then they withdraw, and then they're miserable, and then the provider is miserable. So it's a big deal.
Well, and it's unfortunate for us because there's some problems with the national healthcare system. You have access to care everywhere.
Right.
And so if a patient has something in a chart note from a provider that uses the same EHR and EHR that uploads into it,
Right.
you get some of that history and you get to understand what's going on. I get, at best, a diagnosis code. I get a letter and 3 digits without a decimal in it, so I have to figure out where the decimal falls and figure out
Right.
what they have going on. And then ask myself, am I going to go against my limited resources of so many of this controlled substance per month and potentially jeopardize my other patients that I've already verified?
So like so much in medicine, you're asked to guess about a really, really important thing. So that sounds like Cures. And let me explain what Cures is. Do you use it? Yeah, you check it for me
We use it
sometimes.
on every controlled substance.
Right. And so we go, it's within California, I think, but they're going to expand so it'll have ties to other states.
So every state has it,
Right.
but it's not Cures in every state, but there's a
Right.
PDMPA in every state.
Right. But I don't get Oregon information. So what that is, I go online and I put the patient's name and birth date in, and I find out where they've gotten all the controlled substances they've gotten. I think it goes out a year for me. So, and that has really limited information, like you're talking about, only a line of data, and you have to make decisions based on that. And it's with super important consequences for the patient, also for the provider of service legal license. Is that what you're saying, pretty much?
So, yeah, I mean, Cures is one aspect. The information on the face of the prescription, even if it's transmitted electronically, there's still a face of the prescription.
Right.
But there's limited data for us to be able to make our decisions. And so then, when I tell a patient that I have to call and verify some information, well, what's wrong? Well, this other pharmacy's been filling it for the past 2 years with no questions.
Right.
That's great, but I don't have that information. We don't share. We're not in the same system. And I happen to know from talking to patients that it hasn't been verified. None of that's out there.
Right.
And in light of the current guidelines, especially for opiates, there are things that need to be talked about. And, I spoke with one of the clinic directors yesterday at home. And, his end was, at the end of the day, Mike, we do need to get patients off of these meds because it's not the right thing for them.
Right.
Because, that's what the guidelines say. And, we could talk about this day in and day out, but at the end of the day, when we talk about opiates, there are people that do have legitimate pain, and they have pain that can't be addressed in other means. And those people, we owe it to them to alleviate their suffering.
Right.
And currently, we don't have a better option. There are things in the pipeline. There are things that actually are available, but aren't being widely used. But when we think about opiates and what they do and the things that we know from some of the follow-up studies that have been done in the last 20 years, they actually do more harm than good.
Yeah, I'm not surprised at all.
Ischemic colitis, opioid-induced hypogonadism.
Right.
I can't tell you how many people I've seen after so many years on opiates, all of a sudden they're on testosterone, all of a sudden they're on estrogen replacement, even though they're not menopausal.
Yeah, and their whole experience of pain lifelong is going to be different. It's going to, their whole mu receptors and all that. But so what you're saying is that losing this pharmacy is going to be especially hard on people who are on chronic pain meds, especially opioids, and they're going to have to be super patient. Another group that I worry about is the mom of a sick kid or an elder with pneumonia on a weekend. How hard is it going to be to get medication that they might need? And that needs to be that's an acute issue, so it needs to happen in a timely manner.
Right. And currently, because we don't have enough staff, at my pharmacy nor at the other larger volume pharmacy. Actually, the other two that should be larger volume, but that's a whole nother mess.
Whole nother talk.
Is nobody can be open on Sundays with the exception of possibly Safeway. And I feel comfortable saying that one because they have 2 staff pharmacists and they have enough technicians that they could potentially be open on Sunday. But again, they don't have a lot of inventory because they're a low volume store. And so,
even with the UHS connection?
Well, UHS is only acute meds and controlled substances because the UHS made the decision to pull everything into Potawatomi.
Right.
When UHS made that decision, it pulled a lot of business away from the contracted pharmacies.
Oh, okay.
And so it was a smart business decision for them financially, but logistically it created a nightmare, and it hurt this community a lot.
Oh, interesting. Huh.
Because up until they made that decision, we were their number one pharmacy of choice. Mm-hmm. And when they took away the maintenance med piece of it from us, the corporation took a look at that and said, that's not something that we want the liability of.
Right.
Because it's going to put a target on our back.
So UHS is talking about opening a pharmacy in Humboldt County.
Mm-hmm.
There's, my small voice is here, us.
Mm-hmm.
How do you think that would affect things? Or
I think that would actually be, so if it was an outpatient pharmacy that was patient facing, that's great for anybody who is Klamath and South.
Okay.
But anybody who's on this side of last chance grade, again, we have road closures, we have all the, it's a long drive, it's an unsafe drive. Not everybody up here who utilizes UIHS has access to transportation on a daily basis.
Right. You also have to remember that Tolowa Nation goes up into middle of coastal Oregon, actually.
Right.
So, the political boundaries that the United States has, not as relevant to them. So, although it is.
And that brings up another point, which is the multiple calls that I've had to been making to you over the past few weeks, which is the licensing of UIHS providers.
Right.
You can practice inside of UIHS on a license from any state because it's a closed healthcare system. But as soon as you send a prescription to an outpatient pharmacy, you have to be licensed in the state that you're sending it from.
Right.
And we have several visiting providers, both in the medical and the dental side, that aren't licensed in the state of California. And I have somebody showing up at my pharmacy at 6:30 saying, I need my amoxicillin, and my system can't process it because that provider's not licensed in this state.
Right. That's why Mike and I are texting back and forth all day long. Yeah, and I watch my phone for your texts. Thank you. We're kind of like, sadly, a functional team.
Well, and the reason that I'm now texting you to please call me at the pharmacy is I had a call with corporate saying no more texting of providers. You have to get that verbally over the phone.
Okay, that's fine. I'm cool with that.
Yeah, like they're and there's good reason for it. I mean, there is a possibility for an accuracy issue, that type of thing.
Right.
And so it's a smart decision on their part. It makes things harder on you and I.
So we're kind of enmeshed in this, I don't know, web of rules, oftentimes conflicting, and now with the loss of another pharmacy, hopefully it's not permanent. Do you have any sense of that? It seems that that's going to make everything worse.
So I can tell you that key staff on the store side have already started other jobs.
Okay.
And so I don't think that there is a plan for a reopening. And it's really unfortunate because that corporation acquired another pharmacy in Brookings. And because it was within a certain radius, they were able to close that pharmacy.
Oh, is that what happened in Brookings? Oh, dun, dun, dun.
And so they closed that pharmacy. And now, because of a problem that they weren't able to foresee happening at a corporate level,
right,
they now have to make this decision to shut this pharmacy. And so now we have really a loss of 2 pharmacies in what we consider our community, because Del Norte and Curry are sisters.
Right.
and the only pharmacy that's open regularly in Brookings is overloaded. There's lines out the door every day there.
Right. I hear complaints about that too.
And it's not that they're not working hard. It's not that they're doing their level best. Pharmacy is a small world. We all know each other.
Yeah.
A lot of us went to the same schools or did rotations or residencies together. And so we all know each other. In fact, the old pharmacy manager at that pharmacy, she went to the same school I did 2 years behind me. We have a lot of the same friends. We played in a lot of the same places in Idaho. Up and down the coast, you can find grads from my school. There's one working at St. Joe's. There's one at Bay Area Hospital in Coos Bay. I was just on the phone with them yesterday. Like, we're everywhere. But we all know each other, and we all know each other's problems. And that my heart goes out to that pharmacy because we have so many OHP patients, which can only fill in Oregon. And if you live in Brookings, the next pharmacy is in Cave Junction.
Yeah, which goes along with a trend for rural pharmacies is that you have to actually travel. And Del Nordians are kind of used to traveling for their medical care. But if there's a tree down on 199 or you're not comfortable driving in snow, that makes it. I feel like we're in Nome again, bringing the diphtheria antiserum to the children of Nome, with Balto and mush. So, and I don't think that people making decisions on a corporate level understand the reality of that life.
Right.
Yeah. So.
Well, and they don't understand the reality of our small town life. I get questioned on a regular basis. I get all sorts of questions about my activity outside of work. Well, why would you go to lunch with a patient? Well, I'm sorry, there's 6,000 people in this town, and I'm friends with this person.
Eventually, you're going to be friends with somebody. And doesn't it make sense that people you're friends with seek you out for care because they trust you? Happens to me all the time. All the time. That's why I pretend I don't know people a lot, and they think I'm just daft.
I'm sorry, her daughter dated my son.
Yeah. There you go. So, it is really hard to be. So what would attract a quality pharmacist to a town like this? What kind of parameters would they need beyond the usuals, like money? So housing in your situation, what else?
So number one is housing. I have a patient who's qualified for a VA loan, and he can't buy a house because every house that he attempts to purchase doesn't meet VA code. And, for myself, I need a 4-bedroom, 2-3 bathroom house for the number of children I have. And there wasn't one readily available at any price point after I lost my housing back in 2021. And now, still the price points were ridiculous because I know what those houses are going to be worth in 5 years when the market levels out. Right. And I won't be able to refinance it for 20 years. That's ridiculous.
Yeah.
And I understand that the market is what the market is, and I don't hold the sellers accountable for trying to make the most money they can. Yeah. But the reality is pharmacists aren't stupid people, and neither are doctors, neither are PAs, neither are NPs, and we're not going to make dumb financial decisions.
Right.
And so when we see this housing market, nobody wants to be here.
Right. Or even if you were, what if your personal plan was to be here for 2 years out of school?
Right.
And rent a place until you go to somewhere else that you have your eye on.
Right.
When you have more experience, even rentals are hard. You had that problem finding a rental too.
Right. It's very difficult to acquire housing. So that's the number one issue is the housing here. And even when I was trying to stay here in 2021, seeking a new building permit, depending on where your property is. If you don't know the right person at the Coastal Commission, you're not getting one. And so the politics of Del Norte County, which talking to, people in emergency services, who I have some relationships outside of work with several of them. Some of the things that are happening there are not okay.
Right. And those things have consequences. This is a consequence of that. Then you can't get your amoxicillin for your sick kid on a Saturday.
Right. And so, housing is an issue.
Right.
Some of the things that are happening in Del Norte County at an administrative level are an issue.
Right.
We haven't been able to retain a psychiatrist at our county mental health services in the entire time I've been here, which is since 2015. I mean, we had one provider for
Commuting up from Humboldt, Dr. Wilson. Yeah.
right, and before her was Jerry Cabina.
By the way, she really liked that job. She was good at it.
Yeah, and I like Jennifer. She was a sweetheart. She was easy to work with.
Right.
Anytime I had a concern, she would either alleviate that concern by explaining what was going on or agree with me on my recommendation. And
so you can't find specialists here. Like I had a patient who died recently for lack of a pulmonologist. So, and we're all aging and we're all stressed. We're all stress monkeys for sure. So our own personal health care is a consideration, I think, too. My primary is in Humboldt.
Well, and you actually you kind of open a new can of worms for me. As a pharmacist, and actually I answered this question during my interview for pharmacy school, one of the things that I love doing is being that last line that can identify something that was missed.
Right.
And in the last several weeks, I've had probably 30 patients with right-sided heart failure that their COPD was unaddressed.
Absolutely.
And
I can totally see that.
They go hand in hand.
Right.
I mean, it's very rare that you find right-sided heart failure without COPD.
Right.
And no maintenance inhalers, no anticholinergics, no leukotriene antagonists, nothing that are the mainstays of COPD anywhere on their medication lists.
Absolutely.
And so, quick question while I'm counseling them: have you ever smoked in your life? Oh yeah, no, I'm still a smoker. Okay, chances are you have COPD. It's outside of the scope of my license to tell you that you have it.
Right.
But you should talk to your doctor about it at your next visit.
And all that wheezes is not asthma.
Right.
Yeah, I've seen that a lot. Yeah, so undiagnosed COPD leading to right-sided heart failure, leading to catastrophe.
And that's a messy death. It's a messy, unfortunate death.
Yeah.
That could have been avoided.
Yeah, respiratory is bad. So.
But again, my heart goes out to the providers who are having to see 32 to 45 patients.
Yeah,
a day.
we have seven minutes in the exam room, and I guess I'll open a new can of worms and say I would like to have more actual physicians. Now, as a PA, I really love my profession, rah, go team. And nurse practitioners, I appreciate the collegial help for sure. But there's a lack of physicians here in this county.
Right.
And, we're like running as fast as we can, but there's nothing like a PA physician, colleague bond that can really increase the amount of care that somebody gets and the understanding of what's wrong with them. And that's just not happening. It was, my first mentor was Eugene Stead, who was the man who invented the PA profession. He did not envision PAs and NPs, although he didn't really have a license over them, but going rogue. And I think we do too much going rogue here. So that to riff off what you just said. What else would keep a pharmacist here in this area? Education for their kids?
So education is huge.
That was the thing with your kids, is their opportunity really blew up when they left the area?
Education, entry-level opportunities for their children.
Right.
Here, my kids had access to be a CO.
Right.
Or find a retail big box or potentially roofing and construction or electrician. Right. But we don't have any type of a trade school. CR has a little satellite campus that does a couple of programs, but there's no real opportunity. And like my oldest son, he landed a job in Clark County in Vegas, where he's working for the school district. He's a PERS employee. 5 years there. He has full retirement benefits. And he's going to school to become an aircraft mechanic. He's going to be an A&P cert.
And he's how old?
21.
Yeah. See, that doesn't happen to people
That doesn't
here.
happen here.
No. I would say school-age kids, especially high schools, they don't get dreams fed to them. They get actually most of it cut down because there's no resources. And a big dream is to be a nursing assistant. Thank God we need them for sure, but that's not
Right.
That's not the end of that. There's,
Well, and I was asked by a friend not too long ago about what the missing ingredient is for Delaware County.
Yeah.
And you kind of touched on it just a moment ago. Because we have beautiful weather, we have beautiful scenery, we have...
No traffic.
No traffic.
Speak of.
We have some great people here, and really some great personalities. There's people here that I absolutely love and adore. We have some quality providers. There are some providers here that I would entrust with my own healthcare, and more so than I would most of the professionals in Las Vegas. Honestly, very smart people, very in tune people with what's going on.
Very tired people.
Yeah, very tired as well. But the one missing ingredient in Delaware County is hope.
Yeah, there it is.
It's hope. You know, we can call it housing, we can call it education, we can call it entry-level opportunities, and I see it on the faces of a lot of my patients that have generational poverty. There's no hope, there's no outlet for growth, and until we address that, this is going to continue to be an issue.
Right. In so many different ways. Like, who would have thought hope would have anything to do with the pharmacy closing? But no, really, it's there, folks. It's really there.
That's the biggest missing ingredient.
Right.
You know, with Sacramento legislating away a lot of our major industries over the past 50 years,
Right.
Whether it's for good reason or not,
Right.
they're gone and or marginalized.
Right.
You know, our poor fishermen, you know, they get very small windows to earn all their money for the year.
Right.
And then the rest of the year, they rely on Sacramento for unemployment.
Right.
And it's not fair. Like but life isn't fair.
But the flip side is, because I saw that early in my career here, and the flip side is I don't think there's a better place to make a difference. Because, you know, when you're already kind of at the bottom, the only way to go is up, I guess. So that was actually a reason I came here. I found hope in the hopelessness, I guess.
Right. Well, and for me, you know, I very much want to be able to help every person I come in contact with.
Okay.
That's my goal, and my goal is to create hope, whether it's medically, whether it's socially, whether it's, you know, socioeconomically. I try to, as much as possible, you know, solve problems, create hope, create a path forward.
Right.
And there is a stark lack of not only resources, but again, opportunities. And because those opportunities aren't there,
Right.
there's nothing, there's no star to reach for.
This is a really good, we're down to our last minute, I imagine. I'm getting this signal. This is a really good place to say what's the average Del Norters to do. I think we should go to our government and ask them our local government, and ask them how they're going to solve this problem.
I'm not sure that is entirely addressing the issue, or addressing the entire issue. You're talking about things that are here in Del Norte County and opportunities there. I think maybe if we were to find some sort of corporate entity willing to work at a loss, I mean, there's also that side of it.
Okay.
Sure, there's nothing here. We're a rural backwards community and it's shriveling up here. I get that. But as long as you have big corporations used to what happens in places like Sacramento and Bay Area and you know, wanting those sorts of margins and wanting that sort of profitability, I think that's a real problem too. They're coming in with expectations that don't fit this community as well.
So is there a way that could make this situation work for them so they would be interested in continuing,
I mean,
even if it's at a
they're
loss?
making money hand over fist, then how
Right.
about they pay Mike's wage at a loss on the corporate level because they're maintaining a presence in this community? Perhaps they should be compelled to do so
Nice,
too.
I like
I'm
it.
not above that.
Yeah,
But
I
that's
like it.
that's my own bent, and I don't have the insight that you guys have into this whole situation.
Well, and there's things that can be done. You know, I was asked actually when I first landed here for a local charity the corporation could put some money into, and my go-to was CASA,
Right.
but you know, the corporations want to make an impact here. They want the tax write-off, they want the benefit, they want the PR from it. And I was surprised with how quietly they did do the donation that they wound up doing. But the corporations are willing to make the investment as long as there is a cause that is, you know, ethical and
Right.
and good for the PR face.
And Sunday hours for a pharmacy isn't?
So the Sunday hours is a matter of when we work more than 7 days in a row under California labor law, we're on overtime starting on day 8 at minute 1. And so without having another pharmacist here, because you could pay me $300 an hour, but I still don't have a house.
Right, exactly. And that's what I'm saying. It's not, that's only half the issue. And then
Right.
you've got the other half of the issue, which is you land here.
Right.
Okay, what now? Yeah, exactly.
Yeah, where am I going to live in a hotel the whole time?
Right.
Which is what I did for the first month I was here. I lived out of a hotel, until I happened to fall upon a very fortunate opportunity.
Right.
I lived in a hotel.
Right. Yeah, I understand. The nurses adopted me and I couch surfed.
Yeah.
Yeah.
Okay.
So anyway, yeah, I hope that touches on some of the issues that we have to think about. Patience is going to be important as we move forward, but also use our voices. Come on, guys.
Use your voices to say
Use
what?
your voices
To say what?
to demand better.
Okay, there you go. I just don't know who to call.
Call everybody. You'll hit the right person.
Call everybody, and I may put a target on my own back by this, but I will say in Del Norte County, it's time to take a close look at what's happening with the Board of Supervisors. It's time to take a close look at what's happening with the Coastal Commission, what's happening with the meetings that are happening, with the decisions that are being made and the data that they're using to make those decisions, and who's producing that data. Because
Oftentimes, it's independent consulting firms that come in and work for the county to produce that data, and that makes me wonder.
Well, I will tell you this, and I'm very comfortable saying this on air. Recently, on a Thursday, there was a decision made by the Board of Supervisors to hold a meeting that required specific people to be at that meeting on a Monday.
Right. Okay.
And there were key people left out of that meeting who had the data, and they used surrogates for that data, and decisions were made based on inaccurate data because somebody just decided they wanted to do it.
Right, and that was like the least amount of time they had to give a public warning for the Brown Act and all of this, and it wasn't conscientious at all. It was,
At all.
Yeah.
And until we start operating the way that the Attorney General would expect us to operate.
Okay. All right. Again, and just this
Yeah.
always we come back to, you've got to be, and not just in healthcare, but in a community like this, you really have to be your own best advocate across the board, no matter what you're talking about. Yeah. Okay. Mike Henderson, local pharmacist, thank you so very much. It is always very, very insightful to have you here. I just sat for like the first 20 minutes and just listened to you guys, and I'm just, wow, we're so...
You're blown away.
Yeah.
Plus the off-mic stuff. Yeah.
Yeah, that's always interesting too. But so, Mike, thank you for coming in. We'd like to have you back just as soon as we can swing it. I know that could be a tough thing to accomplish, but thank you so very much.
Absolutely.
Thanks, Mike.
Thank you.